video, I think will be enough. Okay, so we'll start with kidney. So the main function of urinary system is the production of and excretion of urine. But besides, also kidneys and the whole urinary system, we can say, performs the other functions, such as regulation of pH, acidity, yes, in a human body, regulation of blood pressure, synthesis of vitamin D, and some other functions. So first we will start with kidneys. Kidneys are organs of urinary system which produce the urine. Actually, all the other structures, they just serve for conduction of urine and storage of urine and excretion of the urine. So, Abdelrahman, yes. You also had to take out nes. In Latin it is ren, in Greek nephros. They are parenchymal organs which perform functions of production and excretion of urine. It is paired organ. The main thing that you have to know is you must be able to distinguish right and left kidneys. So, external structure of kidney is very simple. It has two surfaces, anterior surface that is convex and posterior surface that is flattened. So this is anterior surface, yes. It has also two borders. Medial border is concave and it contains renal hilum. Yes, thank you. Renal hilum. Lateral border is convex. And also it has two poles, superior pole, extremitas superior, and inferior pole, extremitas inferior. Superior pole is rounded and inferior pole is sharpened. So this one is right kidney, this is left kidney. We also can distinguish kidneys by the location of structures in renal hilum. So in renal hilum, renal artery, renal veins, and ureter pass. So ureter occupies the most posterior and inferior position. This is ureter. It is directed downward because it should reach urinary bladder, yes? So that's why this is right kidney also. This one is left. This is ureter also. If we look at this kidney, we will see that anterior surface is convex, yes, posterior one is flattened, medial border is concave, lateral border is convex, and here we can see also ureter. It is directed downward and it is located posteriorly. So this one is left kidney. Topography of the kidneys. This is kidney, right kidney, and this is, here we can see left kidney. Actually, we shouldn't see kidneys here because kidneys are retroperitoneal organ. So they are covered by peritoneum from anterior surface, like that, yes? But because this preparation is very old and peritoneum is broken, that's why here we can easily see kidneys. You have, as always, you should, in topography, know skeletotopy, holotopy, and syntopy. So right kidney is located lower than the left kidney due to the presence of the liver above the right kidney. Skeletotopy of the right kidney, we can say it is located between 12th thoracic and 3rd lumbar vertebra, and for the left kidney it is between 11th thoracic and 2nd lumbar. We also can describe topography, skeletotopy of the kidneys in relation to the 12th rib. So 12th rib crosses right kidney in the boundary between proximal and middle 1/3, and left kidney is crossed by the 12th rib right in the middle. Holotopy of the kidneys. Both kidneys are located in the lumbar region. And syntopy of right and left kidneys is slightly different, but we can say that above each kidney there is adrenal gland. This is adrenal gland. So medially from the right kidney there is descending part of duodenum. Above it there is right lobe of the liver, and in front of it there is right colic flexure. Right colic flexure that is between ascending colon and transverse colon, yes, and so on. So about left kidney we can say that above it again there is adrenal gland. This is adrenal gland again, we can see it. Then in front of it there is stomach, and pancreas. This is pancreas, yes, and also left colic flexure that is located between transverse colon and descending colon. Yes, transverse colon and descending colon. So that is syncope. No, actually, many organs surround the kidneys. You'll read about it in the book. So external structure. I have already told you there are two surfaces, anterior and posterior surface, and two borders, medial and lateral, and two poles, superior and inferior. Longitudinal axis of right and left kidneys does not correspond to vertical axis. So superior poles of the kidneys, they are located closer to each other than inferior poles. We can say that between superior poles of the kidneys there are 8 centimeters in average, yes, and between inferior poles of the kidneys there are about 11, yes, 11 centimeters. Okay. So, kidneys, I told you, are retroperitoneal organs. So that's why when we were discussing structures of organs of digestive system, we were saying that there are ligaments, mesentery, so there are the structures which are formed by peritoneum, which contribute to the fixation of these digestive organs to abdominal wall. As kidneys are retroperitoneal organs, so they are covered by peritoneum from only one side, they need a special fixation apparatus to avoid displacement of kidneys. There are 4 components in this fixation apparatus of kidney, but still descent of kidneys is possible because it's not perfect. Yes, this fixation apparatus. So first component of the fixation apparatus of kidney is coverings of the kidney. Kidney is covered by 3 coverings. The innermost is a fibrous capsule, capsula fibrosa. Here we can see it. This is fibrous capsule, capsula fibrosa. It surrounds kidney from all the sides, and it is formed by connective tissue. Then, outside from the fibrous capsule, there is adipose capsule, capsula adiposa, capsula adiposa. It is formed by fatty tissue, and it also covers kidneys from all the sides, and it even enters renal hilum, and it surrounds this excretory structures which are for excretion of the urine, so they are located even here inside the kidney. This is fatty adipose capsule. Adipose capsule is better developed on the posterior surface of the kidney, and it forms pararenal fat pad, corpus adiposum pararenale. So when person loses weight, when he loses weight suddenly, yes, very fast, then this adipose capsule can be dissolved. Yes, fat can disappear, and at that moment, kidney can descend. Such a process of descent of the kidney is named nephraptosis. So kidney can descend, go downward. Yes, okay. And the outermost covering of the kidney is renal fascia. Renal fascia, so fascia, you remember this word, yes, from when we studied muscles. So renal fascia has 2 layers. Anteriorly is named prerenal fascia, posteriorly is named retrorenal fascia. Prerenal fascia covers kidneys from anterior surface. So from anterior surface, then it goes and it covers renal vessels, then it goes to in front of the vertebral column and in front of the abdominal aorta and inferior vena cava. It continues to the opposite side, again to the vessels of the other kidney, yes, and again goes to the anterior surface of the kidney, the other opposite kidney. Retrorenal fascia covers kidneys from posterior side, and it moves medially, so it it covers renal vessels from posterior side also, and it is attached to lateral surface of the bodies of lumbar vertebrae. So it does not cross, it does not overlap, yes, vertebral column, but it is attached to lateral surfaces of the bodies of lumbar vertebrae. 2 layers of renal fascia, which are prerenal and retrorenal, they join each other at the lateral borders of kidney and also be above the kidneys. Yes. So, and this renal fascia looks like a bag that is opened inferiorly. Below, these 2 layers cannot join together; they cannot fuse because below ureters, which start from the kidneys, they move downward to reach urinary bladder, and they pass between these two layers of renal fascia. So that's why they cannot, like these two layers cannot fuse together below. Is that clear?
Clear.
Okay, fine. Okay, these are coverings of the kidney. The second component of fixation apparatus is renal pedicle. So, or renal leg. Renal pedicle or renal leg is formed by all the structures which enter and leave through renal hilum. So here we can see this is renal artery, this is renal vein, this is another renal vein, yes, and this is ureter. So they also participate in fixation of the kidney. Because they have definite lengths, yes? So even when kidney begins to descend, it cannot descend too much because the length of these vessels, renal artery and renal vein, is limited. Abdominal aorta cannot be displaced, yes, because from the aorta another vessels also arise. So that's why kidneys will descend, but not that much significantly, because renal leg also participate in fixation of the kidney. The third component is muscular seat of the kidney, or renal bed. It is formed by muscles which form a place, like seat, for the kidney, where kidney lies. So it is presented by four muscles. Above it is lumbar part of the diaphragm. Below there are two muscles, psoas major muscle and quadratus lumborum muscle, yes, and laterally it is transverse abdominis muscle. And the fourth component, it is intra-abdominal pressure. Intra-abdominal pressure is formed by muscles of the anterior and lateral groups of the abdomen. So it is rectus abdominis, external oblique, internal oblique, and transverse abdominis muscles. So these are four components which contribute to the fixation of the kidney. That was about external structure. Now internal structure. So I told you that kidneys participate in both production and excretion of the urine. So production of urine is performed by kidney parenchyma. Kidneys are parenchymous organ, and parenchyma is located at the periphery. In the center we can see structures through which urine passes. So these structures serve for excretion of urine. These structures are known as pelvic-calyceal system of kidney or fornical apparatus of kidney. It is named pelvic-calyceal, we'll say about it later, because it consists of calyces or cups, yes, and then renal pelvis. And from renal pelvis, urine moves to the ureter. Okay, so first, a kidney parenchyma. Kidney parenchyma consists of two parts. Peripheral part is named renal cortex. Central part is named renal medulla. Renal cortex consists of alternating darker and lighter lines. They are numerous. Darker line is named convoluted part, and lighter line is named radiate part. Radiate part in the renal cortex with two surrounding it radiate parts form cortical lobule. So this convoluted part and radiate part have different color, so one is darker and another one is lighter, because they contain different parts of morphofunctional unit of kidney. What is morphofunctional unit of kidney? We will talk about it later. So in the renal medulla, here we can see renal pyramids, one pyramid, another pyramid, yes, third pyramid, and they are separated from each other by means of renal colons. So renal colons contain interlobar artery and veins for blood supply of kidney. Renal pyramid with part of renal cortex that is located close to it, and with corresponding parts of renal colons here forms a renal lobe. You have to know what is renal lobe also. So renal pyramid also contains some parts of nephron. Nephron is morphofunctional unit of kidney. So urine is produced by nephrons, and then through the excretory ducts, collecting ducts first, then papillary duct, it moves towards the apex of the pyramid. So pyramid has base is directed towards the renal cortex, and apex is directed towards the pelvic calypso system of kidney. At the apex of each pyramid, we can see renal papilla. Here we can see it, through which urine goes to the minor calyx. So renal papilla first opens into the minor calyx. This is minor calyx, this is another minor calyx, one more calyx. Here, what can we see here? Here we can see adipose capsule very well, yes, developed. Okay, and then 2 or 3 minor calyces, 1, 2, 3, they join together and form major calyces, calyx major. Then 2 or 3, well, all the major calyces of one kidney, they join together and they form renal pelvis. And from renal pelvis, I told you, urine goes to the ureter. So that is internal structure of the kidney. So ureter. Here it is. This is ureter. It is in Latin, it is also ureter. It is hollow organ. It belongs to the urinary system. The main function of ureter is to transport urine from the kidneys to the urinary bladder. It is also retroperitoneal organ. Hollow, I told you, yes. It has 3 parts. The longest part, it is pelvic part. It starts with uretero-pelvic junction in the kidney and ends in the terminal line or pelvic inlet. What is the terminal line? How it is formed? You should revise, and we'll discuss at the next lesson. Then pelvic part. Pelvic part starts from the terminal line and then it goes to the urinary bladder. Yes, so before inferior boundary of the pelvic part of the ureter, it is entrance into the wall of urinary bladder, here. And the last part is intramural. When ureter passes through the wall of urinary bladder, it doesn't have a straight course. It has oblique. It goes obliquely. So from the place of entrance into the wall of urinary bladder and up to the ureteric orifice, here it is intramural part of the ureter. Diameter of ureter is not equal at all the levels. There are 3 constrictions where kidney stones can stuck. Yes, so 3 constrictions. The first constriction is located at the level of uretero-pelvic junction. The second constriction is located at the level of terminal line, and the third constriction is in the wall of urinary bladder. Okay, it was about, I didn't tell you about the topography, yes? So a superior boundary of ureter is located at the level of first or second lumbar vertebra for the right kidney. For the right ureter, it is second lumbar vertebra. For the left kidney, it is a ureter. First lumbar vertebra, yes? And, okay, what did I have to say? Yes, second or first lumbar vertebra. An inferior boundary of ureter is located in the pelvic cavity, so when it enters bottom fundus of the urinary bladder. So it is located it starts in the right and left lumbar regions, yes, and then it continues to the right inguinal and left inguinal regions, and then it continues to the pelvic cavity. So syntope is also simple, you will read it. Okay, yes. So internal structure of the ureter. It is hollow organ. There are 4 layers in it: mucosa, submucosa, muscular layer, and from lateral and from posterior sides, it is covered by adventitia, and anteriorly, as it is retroperitoneal organ, like kidney, it is covered by serosa. Mucosa of ureters is covered by transitional epithelium. What is it? We will also discuss at the next lesson. You will tell us. Then submucosa participates in formation of folds. In the ureter, folds are longitudinal. And then muscular layer. In proximal and middle 1/3 of ureter, there are 2 layers of muscular membrane. Internal one is longitudinal and external one is circular. In distal 1/3, there are 3 layers. There is internal longitudinal, middle circular, and external is again longitudinal. And so from outside, I told you, it is covered by adventitia. Urinary bladder. In Latin, it is vesica urinaria. in Greek cystos. So it is also organ of urinary system that participates in storage and excretion of urine. So kidney produces urine all the time, yes, 24/7. And urinary bladder serves for storage of urine. Until there is not a definite amount of urine, we don't feel urges to urinate, yes, to excrete the urine. It helps us to live. Okay. So this is urinary bladder, yes, I told you. This is also urinary bladder. What is the topography? So empty urinary bladder is completely located in the pelvic cavity. If it is full, then its apex can even reach level of the umbilicus. Syntypy of urinary bladder in males and females is different. In males, we studied, yes, sagittal section of peritoneum. In males, behind the urinary bladder there is a rectum, and between urinary bladder and rectum there is a rectovesical pouch. There are also some organs of male reproductive system between rectum and urinary bladder. These are seminal vesicles, vas deferens. We'll talk about it later. Below the urinary bladder there is prostate, and in front of it there is pubic symphysis. In females, due to the presence of uterus, behind the urinary bladder there is uterus. Behind proximal and middle 1/3, superior and middle 1/3 there is uterus, yes. And behind the distal, behind the fundus of urinary bladder, there is proximal 1/3 of vagina. And in front, again, there is pubic symphysis. So what can we say about external structure? In urinary bladder, there are the following parts. There is apex. From the apex of urinary bladder, urethus starts, yes, and it moves upward and reaches the umbilicus. And urethus forms median umbilical fold of the peritoneum, if you remember. Then there is body, the largest part it is body. Then fundus of urinary bladder. Then neck. Neck of the urinary bladder continues to the internal urethral orifice. Here at the neck of urinary bladder, there is a triangle, vesical trigon, or Lieta's trigon. If we talk about internal structure, then submucosa is present in everywhere in the urinary bladder, and because there are very many folds, yes, we need folds in urinary bladder because it needs to be able to expand, yes, when there is big amount of urine. The only place where there is no submucosa is this Lieta's trigon or vesical trigon that is bounded anteriorly by internal urethral orifice, and from the sides these are ureteric orifices. So this is Lieto trigon or vesical trigon. You have to know about it. Okay, so internal structure. I told you there is mucosa. It is also covered by transitional epithelium, just like ureter. Then there is submucosa that is well developed, and it is absent only in the Lieta's trigon. There is muscular layer. Muscular layer is formed by 3 layers. Internal one is longitudinal, then circular middle one, and then again longitudinal. And they all together form a single muscle, musculus detrusor urina. When we studied digestive system, we were saying that muscular membrane of the intestines consists also of several layers, like 2 layers usually, and different parts of muscular membrane of intestines, they are able to contract independently from each other. Yes, this process is named peristalsis. So one by one, they contract and they push chyme forward. Here, muscular membrane of urinary bladder forms a single muscle, detrusor urine muscle. And this muscle contracts all the fibers. They contract at the same time to excrete the urine. And the outermost layer is adventitia and serosa. So empty urinary bladder is located retroperitoneally. So only posterior wall of urinary bladder is covered by peritoneum. Full urinary bladder is located mesoperitoneally, so lateral walls and posterior wall are covered by peritoneum. But anterior wall that faces pubic symphysis, it is never covered by peritoneum, so it is always covered by adventitia. So that is about urinary bladder. Okay, one more thing that you also have to study, urethra. We will not study it for now because it has different structures in males and females. So we'll study it together with male and female reproductive system. But one more organ that you have to study for the next lesson, it is adrenal gland, glandula suprarenalis. Suprarenalis, it means above the kidneys. So adrenal glands are located above the kidneys. It is paired organ of endocrine system. And what can we say? So right adrenal gland is triangular in shape, and left adrenal gland is semilunar. It is endocrine gland, yes, I told you. There is, if we talk about internal structure of adrenal gland, then there is cortex and medulla also. Medulla of adrenal gland produces epinephrine and norepinephrine. These are hormones which are responsible for aggression. Yes, like for stress reactions, let's say so. They are excreted into the blood, and then cortex of adrenal gland consists of 3 zones. There is glomerular zone, zona glomerulosa, then fascicular zone, and then reticular zone. Each of these zones produces different hormones. A glomerular zone produces mineralocorticoids like aldosterone that is responsible for regulation of blood pressure, and then fascicular zone produces glucocorticoids, cortisol. It is responsible for metabolism of carbohydrates and for some other functions. And reticular zone produces male and female sex hormones, androgens and estrogens, in both males and females. So that is about adrenal gland. Any questions up to here? No. So please take your seats.
Excuse me, doctor.
Yes.
Can you show us another time, another more?
Another what?
More time.
What exactly?
The gland here, because I haven't seen.
Gland is here. That's it. This is right adrenal gland.
And the left one.
And this is left adrenal gland. That's it.